Okay, why don't we go ahead and get started, everybody? Thank you so much for joining us today for our webinar on pediatric mental health screening and mindful self-care in the time of COVID-19. What an unusual time this is. My name is Dr. John Frampton. I'm a clinical psychologist, co-founder of Formative Psych Services with offices in Northbrook, the Ravenswood neighborhood of Chicago, and down in the Loop area. I'm also a lecturer with Loyola University School of Ed on developmental psychopathology, and I'm really excited to be here with you all and with my two panelists, who I'm going to let introduce themselves. Eileen?
Thank you for making the time to be here today. I am Eileen Holt-Turner. I am a clinical and school psychologist with a background working in children's hospitals and school settings, with focusing on children and families with a range of emotional, behavioral, and learning issues. Katie?
Hi, I'm Dr. Katie Gorham. It's wonderful to be here with you all today. I have a history of working with students of all ages in school settings, and I'm currently working with children, teens, and families in the private practice setting.
Thank you, guys. And Formative Psych Services has been around for just a little bit over 4 years. We're in network with Blue Cross Blue Shield PPO. We do individual therapy, group therapy, school-based neuropsych assessments, and a whole lot of school consultation. And we had the opportunity to partner with over 35 school districts in 2019. And that really is in line with one of our main tenets and principles that we were founded upon, which is the collaborative care model. And it's why we're really excited to have you guys here today, because when we think about our treatment plans and our treatment teams to help facilitate the plans and get the outcomes for the kids that we work with, you're obviously a really integral piece. So the provider healthcare, as we have found to be just the trusted source by families, and why we're able to have some of the success that we are able to have with the kids that we work with. So thank you for your work on the families that, on behalf of the families that you serve. Today, we're going to run about 35 minutes, and then we'll take question and answers for anybody who wants to stick around subsequent to the 35 minutes. And here's what our agenda looks like. I'm going to talk a little bit about what we've learned from past pandemics, as well as the current pandemic and its impact on children's mental health. Eileen's going to talk about some tips and tools for screening children during your well visits. To help detect the level of impact, mental health impact COVID-19 has had on your patients. And Katie's going to talk a little bit about screening for parental stress, and perhaps most importantly, she's going to touch upon ongoing provider self-care, which we believe to be a really important piece to this. And so I'm just going to jump right in. You can feel free to type in the questions that we'll take a look at towards the end of our time today. And again, I'll get you a copy of the slides within the next 24 hours via email in PDF form. So let's jump right in and take a look about the pandemic's mental health impact and what we've learned. And I think one of the closest examples is from the Spanish flu, due to some of its similarities in terms of its breadth of impact globally. Happened in 1918. On a personal note, it actually took the life of my great-grandfather, and we saw 4 peaks happen within about a 15-month period, so just shy of the 2-year period between 1918 and 1920. And there was a researcher, as you can imagine, there's not a whole lot of data out there collected on the mental health impact of the Spanish flu, but there was a researcher, Sven-Erik Memeland, who was tracking the number of psychiatric hospitalizations a couple of decades prior to the Spanish flu, as well as a couple of decades afterwards. And one of the things that he found is that within the six-year period following the Spanish flu, he saw first-time psychiatric hospitalizations increase 7-fold. So a pretty remarkable increase. He also found that just in the general population that there were significant feelings of anxiety and helplessness that endured for years following the Spanish flu. I want to cite real quickly Alan Taylor, who's a senior editor with The Atlantic, for the 2 pictures that you see on this slide. He did a photo essay of the Spanish flu. On the right-hand side, you can see a gentleman not wearing a mask and not being admitted to get onto a trolley in Seattle, Washington. And since the Cubs are just getting ready to start on Friday, I had to throw in a baseball photo from 1918. And sure enough, the ump, the catcher, and the batter are all protecting themselves during the course of play to help limit the transmission of that disease, which took the lives of many. A second example that I'll provide has to do with the SARS, and technically I think it's categorized as an epidemic of 2003 that broke out in Asia. And some of the data from the SARS epidemic indicates that for those who contracted the illness, 40% of those survivors continued to meet the criteria for an active psychiatric illness subsequent to contracting SARS. But even more important than that, and something I want us all to be aware of, is that 50%, so half of their family members experience significant psychological problems. And that really speaks to some of the secondary trauma I think we're all going to see in the pediatric and the psych offices and need to attend to from a clinical standpoint. And finally, and I think that this is an interesting piece for both parties to be targeting also, is that overestimation, at least for the SARS epidemic, there was an overestimation in the likelihood of contracting the disease. And I think that really speaks to the importance of providing our patients with accurate information so that we're not incidentally feeding that anxiety monster. And finally, we have already gathered some data and information from COVID-19. Given the fact that it's been broke out in Wuhan in December, we've got a good 7-8 months of data that's been collected, and they were able to do some data analysis to show that 1 in 5 kids were meeting the criteria for anxiety and depression subsequent to the breakout of the pandemic. We know the vulnerability and the hard work that our frontline responders are doing. 1 out of every 2 healthcare workers reported feeling anxious or feeling depressed. Here in the United States, based on a Kaiser Permanente survey, more than half of adults broadly recognize and identify that COVID-19 has had a negative impact on their mental health. I found a piece of research. I was really interested in the idea of quarantining and what kind of impact this was having on kids. And there was a gentleman who conducted a study and was able to compare those that have been quarantined and those that have not. And for those kiddos that have been in a quarantine situation, they were reporting 4 times the number of post-traumatic symptoms as a result of being quarantined. And this is all coming at us in a time in the United States where we were already experiencing, in my opinion, and I think in many of the researchers' opinions, a mental health crisis for our kids. So, what does all this mean? How I think about it in a really practical manner for pediatric health providers is that on a given day, if you see 20 patients, which might be low, but you might have already seen 10 of them today, but if you've seen 20 patients, 1 or 2 are going to fall in that severe category, hopefully are already in treatment, may have had a pre-existing mental health issue prior to COVID-19 hitting, and if not, they should be. 1 or 2 are going to experience some moderate distress, maybe struggling and putting forth a whole lot of energy into managing feelings of anxiety and depression. And then 1 or 2 may benefit more so from just preventative services, engaging in some of that mental health fluoride, as I like to sometimes call it. And so to talk a little bit more about identifying anxiety and depression in our youth, I'm going to turn it over to Eileen.
Thank you, John. So as primary care providers, parents think of you as trusted professionals vested in their child's overall health. This partnership really grants you access to listen for and look into possible mental health problems that you see in your patients, especially during those well-child, well-teen checkups. And as John just shared, certainly mental health issues are salient during this pandemic climate. We all know that the earlier the intervention, the more likely the positive outcome. Next slide, please. Mental health issues, especially internalizing ones like anxiety and depression that we're going to be talking about today, often go unnoticed. Parents may not think about these concerns. They may not want to acknowledge them. They might think their kids are too young to have these issues. On the other hand, there are some parents who may see their children experiencing an increase in anxiety, some sadness, or other changes in behavior since the onset of the pandemic, and be wondering about what the long and short-term impact is for their kids. So you're typically the front line to be able to assist these youth and families with mental health issues. So there's no need for you to have all the answers. It is important, however, for you to know what to listen to and ask what tools you can have, what strategies in your toolbox, and when to refer. Next slide. Anxiety disorders are the most common mental health disorder for children and adolescents. In fact, for anxiety, it impacts really about 4.4 million or 7% of the children and adolescents. That's a lot of kids. Depression affects about just under 2 million children and teens, or about 3%. It crosses all demographics and SES strata. And as you can see, there's some variation with age, with anxiety and depression, not surprisingly, increasing with age. Next slide, please. So let's talk about anxiety. And one way to think about anxiety, I think this is a simple way to think about it, you may be familiar with it, is to look at anxiety from 3 perspectives. First is normal anxiety. It's reasonable, it's relative to the size of the problem. John Walkup from Lurie Children's, as you may be familiar with, says that it's predictable and proportionate from the size of the precipitating event. We might think of these as taking a test, first day of school, trying to make that free throw in a basketball game. And the next slide illustrates, we might also think of some anxiety around the coronavirus and the uncertainty that might fit into this category. And some anxiety is natural, it's common, and it can be protective and adaptive. The second perspective, as you see on the next slide, is related to the anxiety associated with different developmental stages. You're familiar with this as you see it, I'm sure, daily. Some examples include separation anxiety for those little ones, and then middle school and teenagers, there's issues with performance and social factors, as well as do I fit in? We think of these as stages or phases, and that the anxiety does not last and continue to last over time. The third perspective is that excessive anxiety or pathological anxiety. And this is where we're looking to screen for anxiety related to more specific event, in this case, COVID-19, versus anxiety that may be undiagnosed or a subclinical mental health issue. So we're looking to differentiate whether the youngster worries more often and more intensely than other children with the same circumstance, that the worry is unrealistic to the size of the trigger. We also want to see if the anxiety is interfering with functioning and is causing distress. You might see that the focus of their worry shifts, but the child is not able to control the worry or the anxiety. We tend to see the onset between ages 6 and 12, although this is a ballpark. One thing about anxiety and anxiety disorders that is, I think, helpful for us all as healthcare providers is that the characteristics tend to be pretty consistent, so it makes it easier for all of us to identify. And this symptoms, you're likely familiar with the characteristics of anxiety and depression in children and teens. So when children have persistent anxiety, sadness, or irritability, as can be seen in depression with children and teens, or other symptoms of stress, it's time to help the child and family navigate through this time. So how do we do this? Well, listen for clues. For instance, a parent comes into your office and says about her daughter, Emily has been complaining of stomach aches on and off for the past few weeks. From time to time, she also has headaches, and sometimes she just doesn't seem like herself. So in addition to these physical symptoms, she's having trouble concentrating. These symptoms all fit into the criteria of anxiety and depression that we talked about a moment ago, but they also fit into many other conditions and issues from which you're attuned. So the diagnostic tree comes into play, and not only from what may be an underlying condition physically, but also questions to help discern whether there are factors that lead to sorting out whether there's an underlying mental health issue. It's a good time to ask open-ended questions to screen and tease out these issues. The open-ended questions allow the child and the parent to tell their story without being judged. They're also going to provide you more depth and aid you in gathering a sense of how much distress the child or teen is experiencing, including helping you to discern whether the anxiety or depression has an onset related to COVID-19 or not. It opens the door to some conversation. So some questions or starters might be, to what extent do your worries keep you up at night? Tell me about how your tummy feels when you're anxious. Help me understand when you began to notice that you didn't feel like doing those usual things that you like to do. Or when do you notice that you're sad? So these are all questions that can prompt some further conversation. Anxiety often includes fear and uncertainty. This period of pandemic is fraught with the uncertainty. To date, there are not specific screening tools to use as a guide to determine mental health issues related to COVID versus those with an underlying mental health issue. So it does, like many decisions you make, rely on your clinical judgment. So the more you're able to uncover the symptoms of fearing and sadness and irritability, the better you're able to hone in on what determination you're making about how the child is doing. There are a few screeners that may complement your interviews. The first one you're likely familiar with, the Pediatric Symptom Index that is used across many pediatric practices. And this last one, the UCLA Brief COVID-19 Screen for Child Adolescent PTSD, is new. It's free of charge, so you can access it to take a look to see if it's something that you want to add to your practice or not. Okay, before we go into some strategies to address heightened anxiety and some depressive characteristics, I want to share a few parent concerns that have been popping up in our office, and we suspect they're coming to your attention as well. We can talk more about them in the Q&A if you would like. My child does not seem to be as motivated as he was prior to the pandemic. I think my child has executive functioning issues. How much technology is okay? My teen seems to be on a device a lot. And with all the news about school reentry and schools opening just around the corner, school anxiety and school refusal certainly are popular topics. As mental health providers, we do want to touch upon the topic of suicide. With the rate of suicides in our country climbing and the range of victims decreasing, it's important for all of us to recognize and to help families recognize the signs of suicide. Talking about suicide does not increase the likelihood that the child or adolescent will commit suicide. Rather, it allows an opportunity for conversation and understanding of how the child and teen is feeling. And it's important for all of us to keep aware and to help our families keep aware that anyone who expresses suicidal thoughts should be taken seriously. So as we move on, the good news is, the next slide, that most children during this pandemic do well. So what about those children who are experiencing more moderate anxiety and or sadness related to the pandemic? What can you do? So validate feelings, empathize with their feelings. We want to teach kids how to tolerate not knowing. Let them explain how and why they are feeling what they do. You can validate those feelings by saying something like, let's brainstorm how we can make things better. Rather than give answers, we want to have a conversation and be curious with them. Help engage them and problem solve together so that they can feel part of the solution, and it helps to empower them. Perspective taking. Again, talk about the size of the problem relative to the worry. Teach children about the connection between anxiety, depression, and physical symptoms. Tell them that physical symptoms such as stomachache, headaches, muscle tension can often be cues from our bodies about anxious feelings. You can let them know that sleeping a lot or excessive feelings of tiredness can be characteristics of depression. Check in with them about screen time. What are they doing? What about their news exposure? It needs to be developmentally appropriate, and the news should be limited. There's no need for them to watch over and over again. Create a routine and structure in the day, including staying active and healthy eating. You can explore some ideas with them about what they can do daily that they like, that's fun, or that gives them a sense of accomplishment or social connection. I'm going to give them some reassurance, but not too much. Also focus on positive thoughts. There's a tendency with anxiety and depressive individuals to focus on some of the negative and exaggerating or catastrophizing the issue with about what if. We want to turn that around. And also consider a follow-up appointment to check in about those psychosocial issues. And that can be a phone call or having them come in for another visit in your office. These are practical suggestions that can work and help your patients. They can be encouraged. They don't require any additional expenses. They do require some adjustment in their routine and behavior. Next slide. So what about children and teens who do have underlying mental health issues? They are likely to experience more struggle during this time. So how do you help this group? The above strategies certainly are starting points. In addition, we're going to provide in our conversation today supports that you can talk to parents about. This group, though, it's time to refer to a specialist for further exploration and treatment. More often than not, when we may suggest about some therapy, it's not necessarily immediately embraced, especially during this time with the pandemic. So you've had experiences with your own telehealth at this point. We're finding that in our practice, it's been positive. Clients are receptive, they're engaged, and we're seeing progress. We've learned that even little ones who typically play during therapy can do that virtually. And some emerging research is really supporting that there's minimal to no differences between the teletherapy and face-to-face therapy in terms of the interaction between the therapist and the client. So it gives a little extra boost that you can reassure your patients that this is a positive avenue for them. So, and now we'll move on, and Katie will begin to talk more about what you can do with parents and also for that self-care.
Thank you, Eileen. So we know your focus is largely on children during your visits, but this unique and uncertain time of living during a pandemic brings about an opportunity for you as healthcare providers to support families and ask questions that you might not otherwise ask. This obviously is an incredibly stressful time for parents, and parent stress can have a direct impact on child well-being. So because of that, it is important that we think about how a family is coping and managing the changes brought on by COVID-19. And we want to pay particular attention to parents at higher risk of having high stress levels. These are often the parents with higher needs children. So we really want to pay attention to parents of children with significant medical issues, children with behavioral difficulties, with sleep disturbances, or developmental and learning difficulties. You know, these are the parents who are used to relying on a network of support, and in many ways that network has kind of crumbled. So we want to make sure that we're kind of recognizing these parents who may be at higher risk of stress. Next slide, please. One of the ways you can screen for parent stress is simply by taking note of how often parents are contacting the office about issues they're having at home or health concerns they have about their child. Maybe you have families who only come in for their regular visits, but all of a sudden they're emailing constantly or calling constantly because they're frustrated with their crying baby or they're having difficulty with toddler or teen behaviors. If parents are calling in frequently, it may be their way of communicating that they're struggling to cope and that they need help. So you can then just recommend that they come in for a visit or schedule a telehealth appointment, discuss their concerns further, and more accurately gauge their stress and then level of support needed. Another way to screen for parent stress is by asking a few simple questions. Eileen had already kind of discussed that there really isn't anything specific out there to COVID-19 for screening for stress, but the Child Health and Development Institute of Connecticut put together a really nice module on how practitioners can support families during COVID-19, and they suggested asking the following couple of questions to assess how parents and children are managing their current living situations. The first one is geared a little bit more towards how parents are helping their children cope with their current living situations. The second one is a little bit more parent focused, and it says on a scale of 1 to 10, with 1 being not at all and 10 being off the charts, how worried or anxious are you about the virus and its impact on your family? So these are questions that you could ask in person while you're meeting with a parent, or it could be provided on a sheet of paper at check-in or registration so that you have an opportunity to review those responses before you even enter the room with them. If parents indicate having a stress level of about 4 or higher, ask them more about what is contributing to that so that you know what kind of follow-up support to offer. If parents are unsure of how to answer, and they likely will be, you may need to help them open up a little bit by giving them some kind of sentence starters or things to think of. So you could say something like, some families have expressed that they are worried about their family's physical health or their family's emotional well-being. Families have expressed having worries about financial problems or having difficulty managing working from home and juggling being a full-time parent. Maybe the parent is an essential worker and they're worried about contracting the virus or spreading that virus to their family. Some parents have expressed that they just feel alone right now and they don't know how to reach out for help. So knowing that it might be hard for parents to talk about their stressors, especially when they're not in the mindset to talk about themselves, they're coming thinking that they're going to be talking to their child, providing examples such as these can kind of help get that conversation going. And then based on their responses to those screening questions, follow up by asking about their level of self-care. Parents in many ways are busier now than ever, and when we're busy, self-care is often one of the first things to go out the window, even though these are the times when we need it the most. So ask parents if they are practicing self-care, and then remind them that it's important and offer ways that they can benefit from self-care. So as Eileen had touched on before, maintaining routines is a big one. In many ways, we've lost kind of complete control of our normal daily routines, and parents kind of may feel that they're completely out of tune with those routines, but remind them that there are still things we can control in our day. We can control morning routines and bedtime routines and mealtime routines. Remind parents that routines are great for many reasons. They provide a sense of structure that children crave and need, and that can help reduce difficult to manage behaviors. And it takes away some of the many decisions that parents have to make throughout the day. When you have a relied upon routine, that chunk of time is taken care of, and that can lead to significantly reduced levels of stress. Another big one is finding time for relaxation and exercise. Remind parents to get out and relax and do something for themselves. And they may say, that's just impossible for me. There is no time in my day to get away from my kids. And that might be true, and that's okay. And then just encourage them to get out and do those activities with their kids. Go for walks, go for a bike ride, create an obstacle course in your yard, try yoga together. Doing those things along with things like maintaining healthy eating habits can again really reduce those feelings of stress. Another thing you can encourage parents to do is to connect with family members in a safe way and reach out for help from family members if they're able to. Remind them to modify their expectations for what they should be achieving as parents right now. Remind them that it's okay that they're not mastering a new hobby right now. It's okay that they're not teaching their child to master a new hobby right now. In the beginning of this pandemic, there was all this pressure put on people to, you have all this free time and you should be learning all of these new things. And then it quickly became apparent that that's just not possible, but that pressure might still be there. So take away those expectations for the need to be doing more and give themselves the freedom to just be present in the moments that they can be present. Most of all, provide empathy for their experience. Let them know that it's okay to seek help from a mental health professional for their children or for themselves if they're really struggling. All right, so now I'd like to shift our focus away from the children and parents that you serve and talk about how you can manage your own stress and levels of, manage your own stress levels and practice self-care, specifically by discussing the benefits of practicing mindfulness throughout the workday. This may be a topic that you're familiar with. Next slide. But why shift the focus to you? So we just spoke about the importance of helping parents alleviate their stress through self-care and how in times of stress we can forget to really take care of ourselves. You are essential workers. You are helpers, and often helpers help others before helping themselves. And sometimes that's okay if it's temporary. But if we're thinking about our present situation with COVID-19, we are in many ways living in a constant heightened state of stress arousal. Our sympathetic nervous system is in overdrive. And as healthcare providers, seeing patients daily, you are fighting against that stress response all the time, whether you're consciously aware of it or not. And that can wreak havoc on your mental and physical well-being. So for example, stress makes you less focused. It decreases your cognitive capacity. You may get less sleep, which then affects your memory formation. Decreased self-regulation, so you may find yourself being more easily irritated. It can affect your eating habits, so you might be eating more or less, but either way you feel off because of it. It can also affect your level of alertness. So you could see how all of these things can have a very real impact on your day-to-day functioning, especially at work and with the people that you work with and work for. Mindfulness then works to counteract the stress response and bring balance back to the body by making you consciously aware of what stress feels like in your body. Once you can pinpoint that, you can begin to work on reducing that tension so you can be more present and emotionally and physically regulated throughout the day. There is a great deal of research on mindfulness that has identified many benefits, and there's actually an emerging body of research that points to the benefits of mindfulness specific to physicians, showing that it can reduce physician burnout and improve overall well-being in the workplace. More specifically, mindfulness leads to a host of wonderful things for your body: reduced feelings of stress and anxiety, reduced rumination, so that obsessing over a mistake you made or something that you said to the point where it really affects your mood or productivity. It increases your working memory, increases your focus and sustained attention, so you're better able to ignore distractions. You have more cognitive flexibility, so you're better able to maintain a state of calmness in stressful situations. And important to the clients that you serve, it increases your empathy and compassion. So while stress can wreak havoc on our bodies, reducing stress through mindfulness has this sort of positive snowball effect that improves your general health and emotional well-being. Next slide. Mindfulness is not a one-size-fits-all approach to stress reduction, and it can take some shopping around to find the right fit. Fortunately, there are many wonderful ways to practice it, some being simple mindful breathing, yoga, meditation, progressive muscle relaxation, journaling, having a mindful meal, and so on. I always recommend trying a bunch of different techniques, even ones that you don't think will work for you, and actually especially ones that you don't think will work for you, because it's often the things that we don't think that we need the most. But try a few different things out until you find something that feels comfortable and that you can sneak into your routine without too much disruption. And that's kind of the really important piece. Mindfulness is not meant to disrupt our lives. It is meant to add to it. It's not something that requires a lot of time, but like a muscle, it is something that really should be worked on daily, and if not daily, at least several times a week. And the more you work on it, the more efficient you become at recognizing your mental and physical state and making adjustments as needed. Just like I said, a minute a day or a few minutes a week is enough for it to kind of become more of a daily habit, and less of something you feel like you have to do to feel good, and more of something that you're drawn to do because of how it makes you feel. Fortunately, there are many mindfulness apps out there that can be considered digital therapeutics. These are 4 that I have personally tried and really stand behind. Each of these suggested apps offer a range of different experiences, from 1-minute mindful breathing or muscle relaxation to full-on 60-minute meditation sessions or soothing stories to fall asleep to. COVID Coach is completely free. The other 3 offer a free reduced access version or a full access subscription version. I have done both versions for all of these apps and have personally found that the free version offers me all that I need out of it, but just kind of know that there's room to play around and you don't have to spend a lot of money to kind of get what you need. And then a quick note on Headspace. If you have a national provider identifier, they are offering a free subscription through December 31st. And if you are an AMA member, you can get a free 2-year subscription currently. So now, before we close out with our question and answer, I would like to lead you in a quick mindful breathing exercise. This is one of my favorite mindfulness exercises. Meditation on its own, I find, is hard for me. My mind wanders a lot. But breathing exercises give you something to focus on, and slowing down your breathing has an immediate physiological calming effect on your entire body. So I really wanted to share this with you because these are exactly the kind of exercises that you can do while you're at work. They take very little time, and they can truly work to combat your day-to-day stress and help restore that necessary balance back to your body. In the essence of time, we're just going to do about a minute, minute and a half version of this mindful breathing exercise, with a full 3-minute version available on our YouTube channel that you can access after the webinar. So with that, we'll begin. If you feel comfortable, I now invite you to close your eyes and rest your hands on your knees. If you are not comfortable closing your eyes, focus your eyes on the image on the screen. Bring your attention to the touch of your body on your seat. Feel the weight of your body on your chair or cushion. Make sure that your back is straight and that you are comfortable. Take a few deep breaths. While you are breathing deeply, relax your shoulders, your stomach muscles, the muscles in your face, your hands, and your legs. Let go of all the tightness in your body. When your mind wanders, or if you become distracted, just notice what is going on in your head, and then bring your attention back to your breath, going in and out. Notice what it feels like as your breath enters through your nose, goes down through your throat, filling your lungs, and back out through your nose. Now gently bring your attention back to the touch of your body on your seat. Breathe in and out, and open your eyes. I hope you feel more relaxed after talking about all things stress. We want to thank you for our time with us today, but before we go, we're going to open it up to questions that you might have.
Thank you, Eileen and Katie. And at this point, I'm going to stop the screen share and put the 3 of us on. There's no open questions there. I know that there were some chats earlier. First, let me just say thank you, everybody, for joining us. Thank you, Katie and Eileen, for that really valuable information. We'll stick around for a few minutes. If you do have a question, please throw it into the Q&A chat box and not the regular chat box. And I'll keep that posted here just for another minute or two. If you do need to run, we understand how busy you are. We thank you again for joining us and hope you have a good rest of your Wednesday. And we'll wait to see if any of those questions get posted. Yeah, thank you. Thank you for joining us. I see some things getting posted into the chat, so I may open up that window just to make sure we're not missing any questions. Okay, good. So we do have one question. Have you seen an increase in clinically complex cases in pediatric population from COVID? My initial answer to that, and Katie and Eileen jump in if you want as well, is certainly with those kids who had pre-existing mental health conditions prior to COVID-19. Their ability to access services, and in particular for those families that would benefit from more of a wraparound approach where there's a psychiatrist involved, where the child may have significant therapeutic supports happening in the schools, with some of that being absent towards the end of the year. And I know some of the cases that I consult with the schools, we did see the complexity of those cases certainly increase. And the stress at home, I think, had a big contributing factor for those cases that at least I'm thinking about. Anything else you want to add to that, Katie or Eileen?
I do just want to add that, yes, while we're seeing that the clinical complexity increase there too, one of the issues though with this situation is that these issues are usually brought up, or many times brought up, by people who work in schools, by school social workers, counselors, and that's how it's kind of brought to the attention to other mental health professionals to help work on those issues. So that's really why we wanted to speak with you today, is because schools kind of taken out of the mix right now, and those kids are largely unrecognized. So you are still people on the front line seeing them, maybe more so than, you know, staff in the school setting. So it's all the more important that you're able to then recognize those complications.
There's another question about screen time for an adolescent child, and that's certainly a big one. I give some talks to school communities and parent communities on screen time and youth, and I'm going to throw up a little bit in my mouth as I say this, but we have become a lot more flexible in how much flexibility we're offering, especially our adolescents who've been cut off from their peer group. But it is important to think about, I think for the pediatric providers, for parents, for all of us, it's important to think about the quality and still the quantity of screen time that they're receiving. And we can do this through some different ways, but I'll tell you that one of my favorite ways of approaching that issue with an adolescent and with intermediate age kids too is the screen time tool that's available on the American Academy of Pediatrics website. It allows you to have a collaborative discussion with your teen to talk about, hey, you know, how do you want your day to go? As a family, here are some things we're going to require. There's got to be some reading time. There's got to be some family time. You know, if they're involved in a sport or anything like that, they may, or playing an instrument, right? Once you add up all of those activities, you're plugging it into this tool that's available on that website. And then we see how much time we have left. And we say, okay, you know, it looks like we've got a couple of hours each day where you can be engaged in the screen. What are we thinking about this? Does this align with your belief system? So it becomes a little bit more of a collaborative approach where you can mutually decide upon what that time limit is going to be like. The last piece that I'll say about that, I think Katie had mentioned, or perhaps it was Eileen, that the social media related to COVID-19 does need to be monitored. Our stress levels, our sympathetic nervous system will just continue to get triggered each time that we turn on MSNBC, CNN, the news at night, whatever it is that we're watching, whatever's being posted on Facebook, Instagram, whatever's being Snapchatted, et cetera, et cetera. And so we want to be thoughtful about how frequently we're consuming that type of information. The piece that we're certainly much more flexible with are those venues that allow kids to connect with each other. Because that's the piece that we're trying to mitigate the harm that's done due to COVID-19. Been getting some questions about utilizing in-person school versus tele-learning this fall. Can you speak to any development concerns regarding continued tele-learning? So there's certainly concerns, and I think for those kids with special needs, particularly from a behavioral and emotional standpoint, but certainly in other categories of students who are eligible for special education, that's where a big concern is. And I think schools are trying to make special efforts, and we've seen that for some of the schools that are announcing the hybrid model, that the group for students with the most intense learning needs, they're trying to get in full time. I think that's a really hard question to answer. There was a great, if you missed it, the New York Times put out a podcast this morning about the science of reopening schools. And it talks about some of the different countries that have attempted to reopen schools and the different outcomes they've achieved based on how they've approached it. And so there is a little bit of a science to it. I think we're all going to be a little bit anxious about that process. I think the more careful, the more cautious we are about how we're doing that and how it's explained to us and how it's all executed and delivered is going to have a little bit of an impact there. Can we learn through telelearning? Yes, we can. There's been, even pre-COVID, there's been an increase of it happening. I believe that the research states that it's not the quality of being in person. That relationship with the teacher continues to be a really predictive factor and a contributing factor to kids learning. Doug Bolton, one of our colleagues, put out a paper about that process of telelearning, and just a very simple, and it's a little bit from a clinical standpoint, but it provides a three-step process for schools and kind of a roadmap for schools to think about when they're re-engaging students. And that's the first piece that I felt like was missed. And I think just because we were all overwhelmed when COVID-19 hit, but one of the pieces that I saw some schools miss was that reconnection with their students, reestablishing the relationship in order to get the learning happening. Anything you guys want to add to that?
No, I don't think so. I think you covered a number of perspectives that are important.
Okay. Anonymous attendee, we've got, and this is perhaps the last question we'll take before we wrap up for today. It states, what can you recommend regarding clients who have struggled with financial barriers due to COVID and lack of access to community resources to help aid the parents that may also be struggling in the home with their child, say someone who has ADHD and had increased difficulty remaining calm or still to complete tasks? Great question. And probably the hardest one to answer. So I'll let Katie and Eileen answer that question. No, I'm just kidding. I can jump in. But anything that you guys want to comment on about that?
You know, I think it's certainly a challenge. It's a challenge for all kids with e-learning, and parents who are working and or if they're not due to other circumstances. There's a lot of stress going on. So I think one of the things is to look at expectations and what are realistic expectations on any given day, because of what might be typical when sort of life was pre-pandemic to what is now. And I think we need to put the bar at a different place, which in this case would be, let's lower some expectations and what is realistic given the level of maybe stress and uncertainty for the parents, and also what's realistic when there's not the same kind of outside structures that schools can put in with the framework and the supervision and the guidelines that are in place to help kids that have other concerns like ADHD. And I think ADHD can be particularly challenging when you've got a child with attentional issues and or hyperactivity or both at home, and trying to contain that when everything else we've lacked the routine. So I think some of the suggestions that we talked about, both that Katie and I were talking about, with some of the trying to promote an increased structure with sleep and eating and staying active, and in those things that Katie was talking about, it can be riding bikes, it can be walking. I think it's fun. I know families that I know that make the obstacle courses and those just sort of games that you can do to engage your children. that can be helpful. And then I think as far as, there's some developmental issues that look at what age for issues and being able to expect. But, little guys in e-learning, it's very difficult to have really young kids engage independently in e-learning. And so we need to look at what those expectations are, and it's probably not realistic to have your kindergarten, first, second graders thinking that they're going to be able to do the schoolwork and be present as much as we might like them to be.
Yeah.
And one more thing, I know that, and John and Katie, you can speak to this too. There still are, despite the financial constraints for family, there certainly are agencies that have sliding fee scales, and also certainly feel free to contact us and we can talk individually to see what we might be able to do also to help those families, as we are sensitive to the needs and issues that are going on with families at this point in time and are under financial distress.
Yeah, thank you for mentioning that. Okay, I think at this time, if there are any other questions, feel free to shoot me an email. Again, it's jframpton@fpschicago.com. I'm going to be giving you all an email with a PDF of the slide deck. I'm also going to include in the body of that email a link to Dr. Gorham's, I think it's about 3.5 minute long mindful breathing exercise that's on our YouTube channel. Thanks again for joining us today. It was a pleasure to be with you, even though it was virtually. And we hope that you have a good rest of your day.
Good.
Bye, everybody.
Thank you.